So if you're suffering with migraines, or you have a family member or loved one that is, hopefully this video will explain what's causing them and how you can go about getting them corrected without drugs and surgery. Hey guys, Dr. Luke Stringer here, Advanced Health Chiropractic down in South Loop in Chicago. And what I want to discuss with you today is essentially migraines and how chiropractic care can essentially assist and help with migraines without the use of drugs and surgery. So essentially, before we go over how we treat them, what is a migraine? A migraine is essentially a severe headache, and it's essentially really awful when we have a migraine. Many people are essentially knocked out for the day, sensitive to sound, light, smells, and essentially it's all coming, well, there's several types of migraines, but the most common one are those migraines caused from shifts within the spine, particularly those postural shifts. So when you evaluate a healthy spine, particularly your cervical spine, your neck, you want to see spine that's in alignment. The top bone should meet the bottom bone, you should have a 42-degree curve. So when you're in alignment, the weight of your head's displaced nice and evenly into the back of the spine. So when it's displaced nice and evenly into the back of the spine, you create good load into all these discs and these nerves aren't under stress and tension. Traumas may be significant, car accidents or repetitive stresses, sitting for a living, our spine shifts out of alignment. So what we see in the office, particularly with our migraine patients, the spine straightens out and shifts forwards. So this creates an issue. The muscles that anchor the skull to these top two vertebrae called your suboccipitals get lengthened. And when they get lengthened under tension, that tissue breaks down, it becomes weak and inflexible. However, what then happens is these top two joints, C1 and C2, these nerves come out of the neck and go back into the brain. They innervate your eyes, ears, nose, throat. They become compressed due to a misalignment in these upper cervicals. And that's going to create symptoms such as headaches and such as migraines. So how do we address it? The first thing we have to address is alignment within the spine. And here at Advanced Health Chiropractic, we use a technique called chiropractic biophysics, and we address alignment within the spine. So we're going to focus on bringing your curve into alignment. This offers objective long-term improvement, but it also shifts the weight of your head from the front of the spine to the back. That's going to take stress off the disc and the nerve. Second thing we're going to do is address these little muscles that anchor your skull into these top two vertebrae. And we'll do that through soft tissue treatment. We'll take that tissue through range of motion while it's under tension. By doing that, we can clean out all the adhesion, all that collagenous tissue that's formed within the tissue. That's going to allow that tissue to allow the joint to move better. And then we're obviously going to supplement that with physical therapy to engage the neck flexors and these muscles that sit between the shoulder blades. And obviously we're going to address the misalignments through adjustments of the spine. And when you add all those things together, we get really good results with essentially migraines. So if you're suffering with migraines, or you have a family member or loved one that is, hopefully this video will explain what's causing them and how you can go about getting them corrected without drugs and surgery. Hopefully you like this video. Make sure you subscribe to our YouTube channel, like our Facebook page, leave a comment in the feed and we'll get back to you, and we'll see you on the next video.